Hi, I'm Jeremy Boschman with Dental Care for All International. I'm from Texas and I'm a Canadian licensed dental therapist who has provided and taught art procedures using hand drills internationally over the last 2 decades. Early on in my overseas experience, I had the idea of gluing dental burrs into mirror handles to see if that might make art procedures easier. Well, it turned out to be a wonderful discovery since it greatly simplified my art training courses to laypersons. I want to facilitate the introduction of gentle hand drilling to all dental practitioners, especially those who have adopted the medical management of caries, rediscovered in recent years by Dr. Steve Duffin, senior editor of this awesome, groundbreaking manual titled Smart Oral Health, the Medical Management of Caries, available on Amazon. See his links in the description below. This combo therapy of the medical management of caries together with gentle hand drilling is loved by all patients since needles and power drills are not needed. Plus, it's safer against COVID-19 as no air, water, and spray with suction is needed. To encourage dental practitioners to adopt hand drilling, we offer gentle G-drills at our cost. What is a gentle G-drill? It's a straight aluminum handle which securely holds standard dental burrs used together with a small handguard. Now please refer to my hand drilling essentials video notes to which the following demonstration clips relate to. This video will be greatly compromised without simultaneously following my notes. They're designed to go together. Go ahead, watch those videos and I'll just see you in a few moments. Use either a 3-digit pen grasp or a 2-digit grip with thumb and forefinger according to your preference. Stabilize each drill with a finger or hand, however you want to do it. We need to have solid control. And spinning. Spin lightly back and forth in quarter turns. Cut the surface only on the clockwise spin, such as this. I'm going to demonstrate circumferential scraping, but assuming this is my cavity, scraping is basically like drawing circles on paper. So you don't spin anything, you just scrape around. Like that, 360 degrees. And you go relatively quickly. And then you clean as you go. You clean it off and you keep going. You make a lot of time with this, but it works quite well. I highly recommend that the things you learn in this video, that you would practice on a hard piece of plastic and get a sense of what's going on before jumping in on patients. So place your handguard between your middle and index fingers at the base, like that. Select your drill, grease your end in some Vaseline, insert into guard, grip handle with thumb and index finger. Place drill tip in cavity. Align drill handle as perpendicular as possible to prevent slipping and injury. Stabilize burr shaft lightly with your left thumb and index fingers. Then spin handle clockwise quarter turns, applying light pressure with left thumb and index finger. Just light pressure, not to interfere with the friction. Clockwise 1/4 turns. Lift fingers off the handle on the return since burrs cut clockwise. Spin it and lift. Spin cut like this, until you sense the tip has started to anchor. Test the anchor by applying side-to-side circular pressures. If anchored, resume spin cutting while gradually increasing pressure while maintaining perpendicular alignment, while simultaneously, that's a mouthful, adding gentle counterpressure with the opposite hand. Anytime now, see right now we're well anchored, so I can apply pressure, and pressure doesn't hurt because my hand guard. So we want to apply equal pressure. Right now, I'm applying pressure on the head inferiorly as I add a little more pressure all the time on my tooth. I keep my handle stable. I'm not moving it all over the place. All I'm doing is spinning with my 2 fingers while I'm applying equal counter pressure. You can add a lot of pressure and the patient's not going to feel it. And you're going to get through that enamel real quick. If you're using the small sizes, like half and number 1, beware that you only want to penetrate the depth of your burr, such as these. Just the depth on these tiny burr tips. Only bury them the depth of their diameter. This way, if you're not perfectly perpendicular, they won't fracture. However, if you go deeper than that, they're just going to fracture on you. Demo 6 is basically a no-no. It's something you don't want to do. You don't want to just hold your handle and just rock. You're just using your wrists. You're kind of putting pressure back and forth and back and forth. Yeah, you can do that, and you can put your counter pressure and work like this. But what you're doing is you're making a lot of movements. Your hand is going all over the place. You're really only cutting on the right turn, on the clockwise spin. And this is just a lot more movement that I don't feel comfortable doing in front of my patient. Depending on whether you're using a latch or right angle, they're the same, burrs, or HP handpiece, the longer shafted burrs. Either one's going to use a 3-digit pen grasp. The difference is when you're on the shorter burrs, you will keep your fingers on the handle. You're not going to put any fingers on the actual burr stem itself. So you hold it like this. With the longer shafted HP burrs, you will extend your middle finger over on closer to the tip, right on the burr shaft itself. You're going to have a lot more power that way. Same idea, but now you're keeping, and then you want to do it so you have visibility of the tip at all times, okay? So you can actually see what you're doing. Gentle G-drills are in fact X-Acto knives. Be careful when you take out these blades, okay, because they're very, very sharp. You're going to need 2 pliers, either some gauze or paper towel. It's good to have a metal file. Nail file will work. Using extra hard toothbrush with the bristles cut down to about 1/4 to 1/8 of an inch. So they're really, really hard. This is your burr cleaning brush. Loosen the friction grip on these. I'll put this little piece of paper towel in my pliers, okay? And for right now, I'm doing a HP long burr. I'll just throw it in there, get it down all the way, get it snug, and I like to do it on the top first, and then grab it here. This way they won't get scratched up. And just turn them until they're really tight. That's it. Now, if you try to take them apart, they won't come apart. They're really well anchored. Of course, you can take them apart with the pliers, but you don't need to take them apart and take burrs out. Clean them this way, sterilize them this way. Don't be taking them apart and putting them on and all that. Okay? Sometimes you're going to feel a roughness. If it feels fairly smooth, great. If they're not, and you're concerned about that, and most of the time it's not an issue anyway, then just take your metal file and just file it a little bit and smooth it out a little bit. Here you can see the difference in the shaft length between an HP and an RA or LA. Those are both the same. Okay, as you can see. I love the longer shaft HP burrs. The reasons are listed on the notes, so I won't waste your time. Thank you. Thank you for learning gentle hand drilling with me in this video. I am committed to you. If you need further assistance, please email or call me and I will be glad to answer your questions and help you get the drill handles and palm guards that you need. I count it a privilege to be of service to you for the benefit of humanity. I really believe in the wonderful benefits of hand drilling and medical management of caries together and how they can truly impact the world's oral health. I hope you will share this vision with us. See our website at gentlegdrills.org. God bless you all. Thank you.